Imagine your body as a fortress designed to protect you from harmful invaders like viruses and bacteria. Now picture this fortress mistaking a harmless grain of pollen for a dangerous enemy. It sounds strange, but that's what happens when you have an allergy. Allergies occur when your immune system, the body's defense force, overreacts to something that's usually harmless to most people. These harmless substances, called allergens, can be found everywhere, from the air we breathe to the food we eat. Instead of ignoring these harmless substances, the immune system of someone with allergies treats them like dangerous invaders. It releases chemicals like histamine, which trigger a cascade of reactions in the body. These reactions lead to the uncomfortable and sometimes even dangerous symptoms we associate with allergies. It's kind of like your body's alarm system going haywire, sounding the siren for a minor mishap. Allergies are very common, affecting millions of people worldwide. They can develop at any age, from infancy to adulthood. Understanding allergies is the first step in effectively managing them and leading a full and active life. It's about recognizing that while allergies can be challenging, they don't have to control your life. The immune system is a complex network of cells and organs that work together to protect us from harmful invaders. When a foreign substance, like a virus or bacteria, enters the body, the immune system identifies it as a threat and launches an attack. This response involves various cells and chemicals that work to neutralize the threat and prevent illness. In the case of allergies, the immune system mistakenly identifies a harmless substance, like pollen or pet dander, as a threat. Why this misidentification occurs is still not fully understood, but genetics and environmental factors are thought to play a role. When someone with allergies encounters an allergen, their immune system overreacts, releasing a surge of chemicals, including histamine. Histamine is responsible for many of the classic allergy symptoms, such as sneezing, runny nose, itchy eyes, and skin rashes. It causes blood vessels to dilate and leak fluid, leading to inflammation in the affected areas. This overreaction of the immune system is what differentiates an allergy from a normal immune response. While a normal immune response is necessary to fight off infections, an allergic reaction is an unnecessary and often unpleasant response to a harmless substance. Understanding the role of the immune system in allergies is crucial for developing effective treatments and management strategies. Allergens lurk in various forms, from the microscopic particles floating in the air we breathe to the food we consume. Some of the most common allergy triggers include pollen, which are these tiny grains released by trees, grasses, and weeds that are notorious for triggering seasonal allergies, commonly known as hay fever. Dust mites, those microscopic creatures that thrive in warm, humid environments and are a common trigger for year-round allergies. Pet dander, which are proteins found in the skin, saliva, and urine of animals like cats and dogs that can trigger allergic reactions in sensitive individuals. Mold, those fungi that thrive in damp environments and release spores that can trigger respiratory allergies. And food allergies, with certain foods like peanuts, tree nuts, milk, eggs, soy, wheat, fish, and shellfish being common culprits. These allergens can trigger a range of reactions, from mild symptoms like sneezing and itching to severe, life-threatening reactions known as anaphylaxis. Recognizing the common triggers is crucial for minimizing exposure and managing allergies effectively. It's really about being aware of your surroundings and making informed choices to minimize the risk of triggering an allergic reaction. Meet Emily, a bright-eyed 8-year-old who loves to bake. However, her passion for cookies and cakes is overshadowed by her severe peanut allergy. Even a trace amount of peanut can send her into anaphylaxis, a life-threatening allergic reaction. Emily's parents are vigilant about reading food labels, carrying an epinephrine auto-injector, and educating her teachers and classmates about her allergy. Then there's David, a successful executive who developed a sudden allergy to shellfish in his late 30s. What started as mild itching after eating shrimp escalated to a terrifying experience of throat closing and difficulty breathing. David now carries an epinephrine auto-injector and carefully avoids shellfish, but the experience has made him acutely aware of the potential severity of allergies. These stories highlight the challenges and anxieties that individuals with allergies and their families face daily. They also showcase the importance of awareness, education, and preparedness in managing allergies. Living with allergies requires constant vigilance and proactive measures to minimize risks and ensure safety. Identifying your specific allergy triggers is, honestly, the first step in managing allergies effectively. Allergy testing helps pinpoint the substances that trigger your immune system and allows for personalized treatment plans. So, here's a simplified look at the most common allergy test. The skin prick test involves pricking the skin with tiny needles containing small amounts of potential allergens. If you're allergic to a particular substance, you'll develop a small itchy bump at the test site within about 15 to 20 minutes. There's also the blood test, which measures the amount of allergen-specific antibodies in your blood. A blood sample is just sent to a lab for analysis. Allergy testing is typically performed by an allergist, a doctor specializing in diagnosing and treating allergies and asthma. And, based on the test results, the allergist can recommend strategies to avoid your specific triggers and develop a personalized treatment plan, which may include medications or allergy shots, also known as immunotherapy. While avoiding allergens completely may not always be feasible, implementing simple strategies can significantly reduce your exposure and minimize allergy symptoms. At home, for dust mite control, use allergen-proof covers on mattresses, pillows, and box springs. Wash bedding weekly in hot water and vacuum frequently using a vacuum with a HEPA filter. For pet dander control, keep pets out of bedrooms and off furniture where possible, and bathe pets regularly. When it comes to mold control, control moisture levels by using dehumidifiers and ensuring proper ventilation in bathrooms and kitchens, and fix leaks promptly. At school, communication is key. Inform the school nurse and your child's teachers about your child's allergies and any necessary precautions. Develop a written food allergy plan with the school, outlining safe food handling practices and emergency procedures. For non-food allergy management, request accommodations such as seating away from potential triggers and access to hand-washing facilities. By implementing these strategies, you can create a safer and more comfortable environment for yourself or your child, minimizing the risk of allergy flare-ups. While most allergic reactions are mild to moderate, some can escalate quickly, leading to a life-threatening situation known as anaphylaxis. Anaphylaxis is a severe, potentially life-threatening allergic reaction that affects multiple body systems. Recognizing anaphylaxis is crucial. Symptoms can appear within minutes of exposure to an allergen and may include skin reactions like hives, itching, swelling of the face, lips, or tongue. There can also be respiratory distress, such as difficulty breathing, wheezing, shortness of breath, or throat tightness. Gastrointestinal symptoms might show up as nausea, vomiting, diarrhea, or abdominal cramps. Cardiovascular symptoms include a rapid or weak pulse, dizziness, or fainting. If you suspect anaphylaxis, your emergency action plan should be to inject epinephrine immediately using an epinephrine auto-injector if prescribed. Then call 911 or your local emergency number, even if symptoms improve after epinephrine, and seek immediate medical attention. Stay with the person and monitor them closely until medical help arrives. Having an emergency action plan and knowing how to recognize and respond to anaphylaxis can truly be life-saving. Living with allergies can be challenging, but there is hope. Advances in medical research and treatment options have made it possible for individuals with allergies to lead full and active lives. Medications like antihistamines, nasal corticosteroids, and leukotriene modifiers are commonly used to relieve allergy symptoms. Allergy shots, also known as immunotherapy, are a long-term treatment that involves receiving injections of small amounts of allergens over time to build tolerance and reduce the severity of allergic reactions. There are also biologics. These newer medications target specific immune system pathways involved in allergic reactions. Your allergist can help determine the best treatment plan based on your specific needs and allergy severity. Ongoing research continues to explore new and innovative treatment options for allergies, offering hope for a future where allergies are less burdensome. Living with allergies requires adaptation and awareness, but it doesn't have to control your life. With the right information, resources, and support, you can thrive despite your allergies. Support and education are available through organizations like the Asthma and Allergy Foundation of America and Food Allergy Research and Education, which provide valuable information, resources, and support for individuals and families living with allergies. Empowerment through knowledge is key. Understanding your allergies, triggers, and treatment options is empowering, and it allows you to make informed decisions about your health and well-being. Advocacy and awareness are also important. By sharing your story and raising awareness about allergies, you can help create a more understanding and supportive environment for yourself and others. Remember, you are not alone in this journey. Millions of people worldwide are living with allergies, and many resources and support systems are available to help you navigate the challenges. With the right tools and mindset, you can live a full and rewarding life despite your allergies.